Welcome to our coffee chat. Today we're diving into a compelling discussion on tobacco harm reduction in Africa with two exceptional guests discussing a recent report that outlines the potential to save the lives of hundreds of thousands. Joining us is Mr. Joseph Magero, chairman of the Campaign for Safer Alternatives and a leading voice in harm reduction advocacy in Kenya. We're also honored to welcome Uche Olatunji, CEO of Campaign for Safer Alternatives and project manager at THRNigeria. One of the report's key findings is powerful: adopting harm reduction methods such as e-cigarettes and nicotine pouches could save over 600,000 lives in these two countries by 2060. This report emphasizes that harm reduction, alongside traditional tobacco control, could significantly reduce smoking-related deaths. Together, we'll explore the challenges, opportunities, and transformative potential of harm reduction in rephrasing public health in Africa. Thank you both for joining us. Mr. Joseph Magero, if I may ask you, so one of the key findings in this report is that tobacco harm reduction products such as electronic nicotine delivery systems and oral nicotine pouches could be almost twice as effective for quitting smoking as traditional methods. Can you tell us more about the evidence behind this?
Thank you very much, Brian. I assume you're talking about scientific evidence?
Yes.
Well, I mean, so several studies and systemic reviews have shown that e-cigarettes can be more effective than traditional cessation methods, such as nicotine replacement therapy or behavioral support alone. So there's several scientific evidence that is out there. The most common one is, of course, the THRNigeria study, and going by Public Health England as well, which have clearly stated that electronic cigarettes are up to 95% safer than cigarettes. So going by that alone, I believe countries like Kenya and Nigeria need to explore these options, especially because of the fact that we don't have any government-provided cessation services in the country. So that is why we encourage people to switch or use these products, those who are struggling with smoking.
All right. Uche, so you've worked closely with consumers on harm reduction issues. What misconceptions do people in Nigeria and Kenya have about THR products, and how can we address them?
Thank you very much, Brian. I think over the years, as consumer advocates, we realize that there's a lot of misconception, and this has been as a result of knowledge gap in the public, out there in the public, and most importantly, it's hardened to see that health practitioners and health organizations, there's a knowledge gap between them and the public. So this has caused a lot of incorrect views about tobacco harm reduction and also the products themselves. So there is a lot of misconception, which I want to believe we will talk more about in the course of this discussion that needs to be corrected. And the way we can address this issue is to continuously have this conversation ongoing in every facet of the society, starting from the grassroots, giving them knowledge, unbiased information, accurate unbiased information, and this information needs to be readily available to the public, especially to nicotine users, for them to make a more informed decision about themselves. Because harm reduction generally is about making choices of something of a less harmful product.
Sorry, just to add on to that, I think, me personally, I think the biggest challenge is the fact that it's the tobacco industry that is selling these products. I would have wished it to come from somewhere else, and because government and general public just don't trust the tobacco industry, and to convince them that this product is safer, the fact that it's coming from the industry is for me personally, it's the biggest challenge, because now people just generally believe that that it's just a big tobacco front, this new products.
And if I can add on to that, it's not the tobacco industry that developed these types of technologies. It is the consumers that developed this innovation to better themselves away from tobacco specifically. It's just that it became so successful that the tobacco industry decided to participate in the manufacturing of these innovative technologies and such, that it came to happen to be to that. And now exactly we are at where how you've described this. Definitely no, Joseph, I agree. So specifically, I know regulations also are definitely a big part of this. So Joseph, the report highlights that regulatory frameworks in Kenya could hinder the adoption of THR products. In your view, what regulatory changes might be needed to support THR growth in both Kenya and Nigeria?
Now, well, first of all, I think the issue with government is things to do with taxes and the labeling, where they classify these products in the same category as tobacco products. And we all know that there is no tobacco in it. So I fail to understand why, when it comes to nicotine replacement therapy, for example, this is the patches and the gums, they don't have the labels that they're suggesting to have on the new products. So I believe we should consider countries that have been successful in reducing these rates, countries such as Sweden, who officially become smoke-free, and as well as New Zealand and England, in the way that they classify the product different from a tobacco product. So instead of just putting the whole thing in the same basket.
Amazing. Thank you. Okay. If I can reiterate on your previous comment,
Okay.
You specifically said it's this key gap of education. So education is a key recommendation in the report specifically. So what role can local communities and consumer groups play in spreading awareness of THR products?
So it's I just as I mentioned earlier about the knowledge gap in this tobacco harm reduction, we need to keep the conversation going, and not just keeping the information going. It's we have health practitioners. Okay, from the last research we did here in Nigeria, we realized that over 76% of health practitioners do not have understanding of tobacco harm reduction, and 50% of them do not have full embrace understanding of harm reduction. The knowledge is limited. So where we have issues like this, knowledge gaps like this, there's no way local communities will be able to make impact at the grassroots level, and which boils down to us keeping this conversation going, and consumer advocates like ourselves, CASA in Kenya and in Nigeria, and other country members in Africa, keep this conversation going. We have food soldiers in grassroots locations, amplifying this information by sharing pamphlets in different languages, in the local community languages. It could be in Kiswahili or in other Nigerian local dialects, for local communities to be able to understand this thing. So I also believe that a lot of individuals have family members suffering from smoking-related diseases. So if there's provisions are made in terms of educational materials translated in local languages, it would help those at the local and grassroots communities to be able to get this information for themselves, and then the hunger to want to understand more about tobacco harm reduction. Harm reduction generally will be driven high, and this would also bridge that gap, that knowledge gap, on the views and also correct the incorrect views about tobacco harm reduction generally.
Yeah. Joseph, if I can ask you specifically as well, because the report specifically, it emphasizes on the THR awareness among health professionals specifically. What steps do you think can we take to educate and engage physicians in supporting tobacco harm reduction?
I think personally, it's just amazing that majority of doctors in Africa don't even know that nicotine does not cause cancer. I don't know if we need to maybe put out a course for them to understand this, but I think in health forums it's important to have medical doctors that understand the science of harm reduction to teach the rest who don't know, because doctors advise governments and public health practitioners are involved in drafting policy. So I think we should have more forums that teach people on this, especially doctors who handle cessation services in hospitals. They need to learn about nicotine and harm reduction. So we should have more forums on annual basis or biannual basis. Just the same way that remember when HIV was a pandemic in Africa and doctors had to learn about harm reduction in terms of condom use, so they can then advise the people that suffered. We should use the same methodology in teaching them about cessation and harm reduction. That way you get the numbers of smokers begin to drastically reduce.
Yeah, thank you very much. That's a very great answer. Uche, so religious leaders are highlighted as key stakeholders in harm reduction. How do you see their role unfolding in Nigeria and Kenya, and how can consumer groups collaborate with them?
So that has to be a difficult question, because Nigeria and Kenya are conservative countries, and we place our religious leaders in high esteem because of religious practices. So it's going to be a difficult conversation to have with this set of individuals. But I think personally, what we can do individually and also as an organization, the Campaign for Safer Alternative, is to make these religious leaders understand the concept of harm reduction. They need to understand the concept of harm reduction, citing other harm reduction products like the safety features in cars, road signs, and other everyday activities that they can relate with. From then, when they've grabbed the concept of harm reduction, then we now introduce tobacco harm reduction, because they cannot deny the fact that they don't have smokers or traditional cigarette users in their community. So I believe if they grab the concept of harm reduction, introducing tobacco harm reduction to them will be an easy way to make them understand the concept of tobacco harm reduction. So again, it all boils down to education. Education that is slow. Understand how religious leaders in each of these regions embraces information, understand the concept of teachings in their religion, and also use that same method to approach the concept of harm reduction and the concept of tobacco harm reduction to them. Also, we could also relate with them by telling stories that are very relatable. We have individuals in Nigeria here and in Kenya that have successfully quit smoking using tobacco harm reduction products. Now, when we have people like that discussing their own story themselves, telling their stories themselves, it's easy and more relatable because one, they are from the community or from their region, and also they are telling their stories without any biases or any or pushing any scientific agenda in quotes.
Just for some added context from the report, it notes that earlier interpretations of religious texts did not recognize the harms of smoking. And as scientific evidence on tobacco harm has evolved, many religious leaders now actively discourage smoking. So by including THR in tobacco harm reduction in their messaging, they can modernize their approach to health advocacy, and it also provides religious leaders the opportunity to collaborate with governments and health organizations to advocate for lesser harm. Yeah.
Yeah, correct. But I think it's going to be a challenge because even you know that religious leaders don't openly advocate for stuff like condoms and things like that. So that's going to be a bit tough.
Harm reduction at its best. But I also believe that I want to believe if we keep this conversation going, if there is a lot of awareness going and the conversation is ongoing continuously, and I also say thank you to the community generally. We have organizations that are pushing for quarterly and biannual conversations like this. You know, I believe if we push this conversation to the local communities and the grassroots, over time they would come to embrace this concept and understand the importance of using a safer alternative to the traditional one that is well known or known already in the community. I believe if we keep this conversation going, nothing is impossible.
Yeah, it's just awareness, and absolutely no, I completely understand your point. There's a whole lot of people that aren't necessarily aware that there are safer alternatives and safer ways to reduce the smoking prevalence and everything. And that's exactly what we are advocating. That's exactly what we're doing now. And yes, thank you very much. Just keep on going and just do what you guys do too. Joseph, if I can ask you a last question. So when looking at other countries that have successfully implemented THR, what lessons can Nigeria and Kenya take away to avoid setbacks and enhance the adoption of THR strategies?
Well, I think I'll use an example of Sweden, where they have a nicotine policy that is separate from a tobacco policy and a tobacco control policy. Sorry. So we need to like emulate that country, especially now that Kenya are trying to make modifications on the current bill and use what Sweden have done. I mean, they've achieved below 5% smoking rate, which is something which is very incredible, and it's policy that we should copy, if I may say, and use it here as well. We don't have any cessation support from government. So, I mean, to leave smokers on their own like that, perhaps we should begin to introduce products such as pouches and electronic cigarettes. I mean, they're already here, but if we get the regulation correctly, and then we begin to see the trajectory going down in terms of smoking prevalence in the country.
Absolutely. They've been effective in other countries, and to now diminish their effectiveness before it even gets an opportunity to actually help people to quit smoking feels a little bit soon.
Yeah.
Too soon and rushed.
Yes.
Yeah.
I would like to add to what Joseph Magero had mentioned. I think government officials and decision makers need to understand that harm reduction is the right of every individual, of every citizen, and understanding the concept of harm reduction which does not violate the rights of individuals. They need, if they understand the concept properly, they would understand that tobacco harm reduction is also a way of not infringing on the rights of individuals, of their citizens. And if they understand this and understand the rule of law, I don't see any reason why implementing same methodologies in Sweden or New Zealand or in England, in Nigeria or in Kenya should be a problem if they understand these methodologies and the concept particularly.
Yeah.
Thank you. Yeah, that makes exactly. Uche, as someone with first-hand experience in advocating for harm reduction, what do you see as the biggest challenge in implementing the report's recommendations?
I don't. My biggest concern has to be with religious leaders coming being on board on this advocacy, and the challenge would be the what's it called, the moral panic. Because like Joseph Magero had mentioned, that it's hard for you, it's a difficult call for them to advocate for safe sex practices. It's hard for them to advocate for things that are against morals or religious morals, let me put it that way. So it's going to cause a lot of moral panic, and that will be the biggest challenge in implementing these reports. As for doctors, as for the other one, I don't see that as a challenge, but if we can create time, map out activities to get health practitioners informed, that I think is the biggest challenge we have in Africa, because the knowledge gap, that mountain needs to be dismantled. And we can only do this when we have a mapped out agenda for Nigeria and Kenya, and focus on medical practitioners, doctors. It's really sad that you walk into a pharmaceutical store today and ask them, you want to buy paracetamol, and then in the course of your discussion, you're talking about harm reduction, and you see them engaging, and then when you switch, bring on tobacco harm reduction, they seem not to know much. Even the little that they know about the nicotine pouch, or say the recommended ones that is recommended by WHO already, they don't know much about that already. How much less would they know about other safer nicotine products? So all this boils down to education, which I think is not a challenge. We just need to have more foot soldiers at the grassroots level, at the local community level, and also empowerment for organizations like ours as consumer advocates in each of these countries, and we're good to go.
I just wish the report, WHO seemed to be reading from a different script. So we have a problem in Africa where we over-rely on WHO and what they say. And you can see countries are reading from their own script and they're going ahead and succeeding. So
yes,
the biggest challenge I wish is for a report such as this can be endorsed by WHO, then it would be implemented almost immediately. That's another challenge that we're facing here in Africa.
And has proven quite successful in other countries.
Exactly.
Yes. It proved to be effective in Africa as well.
Yeah.
Absolutely agreed.
Yeah.
Well, thank you guys for joining us for this insightful coffee chat. It's clear that integrating harm reduction into tobacco control strategies has the potential to save lives, reshape public health, and offer new hope for countries like Nigeria and Kenya. A big thank you to our guests, Mr. Joseph Magero and Uche Olatunji, for sharing your experience and perspectives. We hope today's discussion inspires action and collaboration toward a healthier future. And stay tuned for our next coffee chat. Thank you very much.